My name is Peter Yelling, and I'm a retired electrical engineer. I've been retired now for about 3 or 4 years, and I was sort of forced retired in the big drop in the technological industry we had here. But so I have my own insurance. I bought my own, provide my own insurance, through Blue Cross and et cetera, And I just recently, the last year and a half, I've been on Medicare, and I'm okay on health insurance, but I'm about driven crazy by what I see going on, with passing comprehensive medical insurance for the country, which I'm for single payer system, which is unbelievably more efficient than what I see from Blue Cross or Blue Shield. I get every 3 months I get a big book at the crossouts of all the things they've changed every month. The rates go up 20–30%. One year it went up 23%, and the reason was rates went up. And I'm sure you've all heard of what goes on with the profits, from the insurance company. It's an unregulated industry, and so I'm very concerned about this Senate bill. And if we don't have some kind of control on the insurance companies, they're going to love it. They get 37 million more people with no regulation on what they're going to charge. And so what is going on? I mean, I saw, with the healthcare bill in the Senate, I saw, Senator Lieberman obstructing this whole thing. I saw the long debate trying to get compromise between the Democrats and the Republicans. Why bother? I mean, it's just obstructionism, and it doesn't go anywhere. I also voted for Democrats. I've been a Democrat all my life, and I'm frankly, if this keeps up, I'm going to think of it becoming independent and just, not supporting certain Democrats. The party doesn't appear to me to be a real party anymore. It's just a collection. It's just a name, and doesn't stand for a whole lot. I guess it's a long, frustrating question, but I guess the substance of it, what are you going to do to prevent insurance companies from being unregulated? Just getting all these new people and just being able to raise any kind of rates they want.
Well, that's a good question, and the position of the House Democrats, and let's say we prevailed in the House, was that you can't just take, if it's 30 million or 40 million, our bill would have covered 40 million new people, and just send them as victims to the insurance companies to rip off. I mean, there has to be a system where people get coverage and they are protected from these rate increases, from the rescissions of coverage, through, a lot of the dirty deals, in my opinion, obviously, that happens to people in the insurance world. I recently saw people say, well, get the health insurance that members of Congress have. I have the same health care plan as the clerks in the federal government, and I'm glad to have it, but it's not as good as what I had when I had the same coverage as the clerks in the county of Santa Clara. Blue Cross Blue Shield has 3.5 pages of pre-existing conditions, everything from acne to, things you never thought of. And why are they there? They're there so that when you get really sick, they can rescind your coverage. So our plan is to prevent that, to prevent the rescission, to remove the lifetime caps, to prevent to regulate the growth of premiums, which means regulating the insurance companies. The Republicans have fought against this, and the Senate has tried to accommodate, because of their rules, to get a bipartisan bill. They're not going to get it. They're not going to get it. And so, as looking from the House side, unless they can do what the Constitution said and have a majority vote so that people can hold accountable the majority party, I don't see a way out of this that's positive. And so I've encouraged the senators I know, and I had a long talk with Dick Durbin, and George Miller and the Speaker have spoken, that you've got to come to grips with the fact that the Senate is frozen, and all of the accommodations are not going to do anything but gridlock us. And I think your comment is one I hear all the time. People are very disappointed, and I don't blame you for being disappointed, because we wanted to do more and it hasn't worked, but we've not given up.